Hello, my name is Hannah Wilson and I am the Mental Health and Wellbeing Officer at YOMO or Young Movers. For anyone who don't know who we are, we're a youth empowerment charity. We're based in the East End of Glasgow. Their office in Easterhouse, but we do deliver services all across Glasgow. So we have three kind of key mental health services that I will talk about briefly today. So we have our one-on-one support service, which is our walking and talking program, and then two group sessions, which are art for communication, well-being, and your resilience. So walking and talking first. So what their service is a one-on-one support service across Glasgow, both the north and the south of the city. It's an opportunity for young people to kind of meet with a staff member or volunteer, just to have a chat, to kind of receive support, guidance, or even if they just need somebody to listen to, someone out with their household, out with their family, to kind of just hear what's going on in their life. Added benefits of the program are it's an outdoor service for the walk. So it's like out the house, getting some fresh air, kind of gentle exercise, encouraging young people back into their community. And it is a user-led service as far as possible. So what we mean by that is the young people choose where they meet. So that can be in their local area or in a more kind of neutral area in Glasgow if they don't want it by where they stay. They also choose when they meet. So upon referral, they aren't given a time slot that they have to fit into. It is up to them when they want to meet. They also choose how frequently. So the maximum it can be is once a week for an hour, but it can be on a much more kind of ad hoc basis. If they just want to get in touch, once they've been referred into the service, they can get in touch and just kind of let us know how often they want to meet. And this obviously can change throughout the course of their time on the program. What it's not is it is not a formal counselling service. So none of the staff are trained counsellors, therapists, psychologists. So we do not support young people who with kind of more severe mental health needs for the safeguarding of the staff and the young people. That's just kind of not where YOMO staff are trained in. So it's not like a suicide prevention service. So who it is for is young people aged 14 to 25 living across Glasgow City. It is for anyone struggling with their mental health and well-being, or those who are experiencing social isolation and loneliness. Anybody kind of just requiring someone to talk to, someone to listen to them. There is no minimum kind of entry requirement. Anybody can be referred into the service. There doesn't need to be a formal mental health diagnosis. There doesn't even need to be specifically mental health issues. Like I say, it can just be if someone isn't getting out, they've become increasingly isolated. So the referral process is a very straightforward process. It's one form that needs to be filled in. These forms are available kind of upon request from myself or any other YOMO staff member. Shortly, they will be being added onto our website. There's a section on our website with our mental health services, and soon the referral form will be up there as well to be able to be downloaded. It's just not yet. So absolutely anybody can refer a young person to walk and talk, including the young people themselves. So currently we've kind of had like community links workers, social workers, pastoral care teachers, family liaison officers. There's been a whole host of people, but this is not an exhaustive list. It is absolutely anybody. The only kind of hard and fast rule for our referral process is that the young people must have consented to take part. They want to take part. They know the referral is being made, so that when I contact them, they know who I am and they're expecting someone to get in touch. So kind of following on from the referral process, the time frame following on from the referral. Once we have the referral in, we'll make initial contact with the person who has referred them, just to ensure all kind of safeguarding issues have been touched upon. So anything that maybe wasn't mentioned in the referral form, but that's important to consider, just to make sure that for the program to be as successful as possible, the most appropriate match between young person and staff member is made. Once that's all been sorted, I will get in direct contact with the young person or the family member of the young person, whoever's been identified on the form. And from there, the time until that first meeting then just depends on kind of the speed of communication with the young people. So sometimes they need a bit more time to kind of sort out when they want to do it, how they want it to work, and other young people are really willing for it to go ahead straight away. There is currently no no waiting list just now, so the turnaround can be within a week, 10 days. As the service grows and we get more referrals, there may be a time where a waiting list needs to be implemented, but currently that's not where we're at. So kind of some final information that didn't fit into any of the boxes. There's no maximum or minimum time commitment for the Walk and Talk program. If a young person is referred in and then after 1 or 2 meetings decides that it's not for them or they're not going to get anything from it, they're not referred for a certain amount of sessions. So that's not a problem if after 1 or 2 they decide to withdraw themselves. There's also no maximum time commitment. They can keep meeting the staff member for as long as they require. There's absolutely no maximum number of sessions. There's also no penalties, the word I use, but for young people missing the meetings, again, because we focus on it user-led, we appreciate that young people are living difficult, potentially chaotic lives, and if they can't always make the commitments, that's not a problem. It's not like if they miss a certain number, they can't come back. They can come in and out absolutely as they need. And then finally, we will support the young people with onward referrals if we feel that would benefit them. This can be if they require additional socialization just to other youth groups, internally within YOMO, externally we will help them find out what's in their local area, as well as that we can, and we have helped young people with referrals to services such as CAMS. If once the staff members met with them, it becomes aware that, or becomes apparent that the issues the young people are going through are not something that our staff are kind of trained at that level to deal with. So that is everything about Walk and Talk. So I'll move on to our first group session, which is Art for Communication and Wellbeing. So there's 6 session programs. That's strictly not true. They're 6-hour programs. They can be delivered in different formats if that would work better for your youth groups. They're aimed at young people aged 14 to 25, and we deliver the sessions to groups of 5 to 15 young people. So with this, it's not a referral on an individual basis. YOMO staff will come into existing youth groups. So the group needs to be in place kind of with a location already. It's not a case of being able to refer individuals into the program. Right now, we're not taking any bookings for it over the summer as our summer program is very intense. But from the autumn, we are starting to fit people in with the sessions, kind of moving on from there. The session is free of charge to youth organizations. Schools and colleges, there is a fee that would be discussed and arranged beforehand. So I won't read all this out because I don't think I have time, but these are the outcomes of the program, and we do have on our website and on the slide them all written out fully, the aims, but I will just kind of summarize. So the aims of the program are to give young people a way to express themselves. It can be a very positive method of self-expression, particularly for those who suffer with verbal kind of communication difficulties, whether that is a language barrier or just mental health isn't something they're comfortable talking about. The art can be a really nice non-verbal way to kind of express how they're feeling. And as well as it being a way to express themselves and their emotions, the program also helps young people learn new kind of art well-being techniques, that if they're feeling anxious or they're feeling overwhelmed, that sort of thing, that they can use these techniques to kind of regulate their emotions. So the last thing I'm going to talk about quickly is the Your Resilience program. So it is the exact same kind of format as the art and well-being, like the 6 hours, a flexible arrangement, 14 to 25-year-old groups of 5 to 15. We found that's kind of the optimum number of the young people feeling heard, getting the attention they need from staff without any less than 5 feels slightly intense. And again, it needs to be within an existing youth group and can be delivered free of charge. So Your Resilience has a specific focus on resilience and helping young people to develop it, to understand what it is, and to kind of explore how this can be used in all different aspects of life, and kind of coping mechanisms for the days that they're not feeling so great, how they can kind of move forward with that. So the topics covered are these on the slide. And yes, that's actually everything I have to say. So thank you very much for listening. This is my contact details here and then our website underneath.